My name is Nicole Dufalu. I'm a fourth semester nursing student and it is April 18th. We have in order to administer a nasogastric tube. I check the history to see if there's any nasal surgery or a deviated septum. I also checked to see if there was any problems with the gag reflex or if they had a mental health issue. So I'm gonna enter my patient's phone. Good morning, Mr. Jones. My name is Nicole. I'm your nursing student for today. Can you please tell me your name and date of birth? Perfect. Today we have in order to administer a nasogastric tube. So I'm gonna bring you up to a good working height. Then I'm gonna put you in high Fowler's. Use my light and I'm gonna assess your nose and the back of your throat. Perfect. All right, I'm gonna push down on one nostril. Can you breathe out of the other? All right. Perfect. All right. So now I'm gonna get you some water so that when I hit the oropharynx area, you will take the sip so that I can administer it further. So I would perform hand hygiene. I'm going to take this out. After checking that it is intact and there are no watermarks on it, I'm going to measure from the tip of the nose to the ear, down to the xiphoid process. Okay, I would say that is about 237. I would put this back down and I would prepare my tape. So I'll perform hand hygiene again. And I will don my clean gloves since this is a clean procedure. Getting this for the lubricant. And I will don my clean gloves. Bring this out and wrap it around my hand, hold it for a little bit and then release. Now I'm going to lubricate 4 inches. I would have the curve facing down towards the nasal floor. All right, Mr. Jones, I'm gonna insert the nasogastric tube. Ready? 3, oh, tilt your head back. Ready? 3, 2, 1. I met any resistance, I would take it out and re-lubricate. If they were coughing or in distress, I would completely take it out. So I would insert it, and once I hit the oral pharynx, I would ask my patient to take a sip. While they're taking a sip, I would rotate it 180 degrees and continue to administer. Then I will tape this to the side of the cheek. Okay, and now I'm going to fix the area. This would be after understanding that it is properly placed. To check for placement, I would aspirate the stomach contents and check the pH, or I could do a chest x-ray, and third, I could listen to the epigastrium. So now it is securely in place. I will take this tape that I used for the cheek and put it on the bridge of the nose. And I would take this third piece of tape and tape it to the patient's gown. Okay. Perform hand hygiene. My tubing is clamped, and so now I will put my patient back. I would document how well the patient tolerated it, by which means I assessed the placement, whether it be through chest x-ray, aspirating the stomach contents, or listening to the epigastrium, and I would also document the insertion of the tubing.
Good.
My name is Nicole Dufalu. I'm a 4th semester nursing student, and it is April 18th. Today I have an order to retract or take out a nasogastric tube. Good morning, Mr. Jones. My name is Nicole. I'm your nursing student for today. Can you please tell me your name and date of birth? Perfect. Today we have a doctor's order to take out your nasogastric tube. So I'm going to assess the bowel sounds. I would make sure there are no signs of nausea and vomiting, and I would also make sure all tube feedings ended 30 minutes prior to this retraction. So I would bring him up, and if my patient was not in an upright sitting position, I would raise them to high fowlers and make sure that they're sitting right. And so now I'm gonna put this towel over the chest of my patient, and I would give them some tissue for if they want to wipe their nose and mouth after I take it out. I would don clean gloves. Okay, now I would unclamp this tubing, and I would put it in and flush 10 milliliters of air, water, or normal saline. I would clamp this here. Then I would flush, take this out, and re-clamp. All right, Mr. Jones, on the count of 3, I'm gonna take your tubing off. First, I would take off the tape, but I would also take it off the gown. Okay, Mr. Jones, ready? 3, 2, 1. Taking it out, making sure it's intact. Okay. I'll just throw this away. I would help them blow their nose if need be, or clear their airway if they so please. take this off, perform hand hygiene. I would lower them back down. This would go into soiled linens. I would document how the patient tolerated it, if there was any discharge and drainage and how much. And if there was any abnormalities with bowel sounds or if there was any issues during the retraction.